Hello everybody. So today we are going to see the next important topic in electrolyte imbalances, which is sodium imbalance. So this also I'm taking you through a small tour on how we are going to compare and study the sodium level when it is high and low. So we all know that sodium is very much an important electrolyte in the body. Of course, can you guess it? Where we get sodium? Yes, it's from the normal table salt. So it's actually playing a major role, such as the same role which the potassium does, is that it's maintaining the fluid balance, enhancing the nerve conduction, enhancing the muscular contraction, as well as it's trying to maintain the acid base balance. So we all know the normal serum level of sodium will be 135 to 145 milliequivalent per liter. So in case of any changes in these levels, either it is low or high, can lead to serious physiological disturbances and lead to certain signs and symptoms. So coming to the comparative study and find out how a hyponatremia and hypernatremia cases looks. So before going in depth onto the signs and symptoms, now you may wonder what is hyponatremia, what is hypernatremia. Ma'am, I don't know how it is. Yes, I'm here to clear that. So here it's nothing but the patient is going to have the potassium level, the patient is going to have the sodium level less than 135 milliequivalent per liter, and in case of hypernatremia, the patient is going to have more than the estimated one, that is more than 145 milliequivalent per liter. And of course, when you take the specific gravity, the patient is going to have decreased specific gravity in urine in case of hyponatremia because all the sodium is being excreted. And in case of a hypernatremia, as the patient's body is retaining the sodium, the specific gravity of urine is very much elevated. So as we already compared that, we are going to see system-wise manifestations here, starting on with the cardiovascular system. So in case of a cardiovascular system, some patients, if they are having the volume is very much normal, might be 2 to 3 liters of blood is being maintained 2.5 to 3, then we call it as normal volemic. In those cases, even though they may develop hyponatremia, so if you take a pulse, their pulse is very much rapid, and when you take the BP is said to be normal. And in case they are having hypovolemia, might be due to some loss, might be RTA or blood losses or fluid losses. Of course, when there is no fluid, the pulse is very much weak and the BP might be unrecordable in some cases, or some cases may show of hypotension. And when the volume is very much low, the neck veins, that is the jugular veins, are going to be very much flat. Then the last one, that is in case of a hypervolemic, the patient is having good and excessive volume in the blood, then the pulse, when you feel, you can see that it is very much rapid and bounding. And some cases, as the fluid is very high, the BP is also elevated. On the other hand, hypernatremia, that the blood content is normal, but still the sodium level is high, hence the heart rhythm is changing, and you can say the heart rate is increased. And when the heart rate is increasing, of course it is directly going to depend on the cardiac output. There is changes which causes the BP also getting altered due to the vascular volume. The next system which is getting disturbed in case of hypo or hypernatremia is respiratory. So here in respiratory, you can see that is a shallow breath and might be as a late sign, that is ineffective breathing, or you call it as dyspnea. In case of a hypernatremia, there is pulmonary edema. And when you take on the neurological symptoms, the muscles are going for weakness, that is decreased deep tendon reflexes. The same thing can be evident on the hypernatremia case as well. When you take the gastrointestinal symptoms, the patient is going to have increased motility, increased bowel sounds, and nausea, vomiting, and abdominal cramps, as we saw in hyperkalemia. Similarly, in hyponatremia, I told you, right? Hyperkalemia can cause hyponatremia as well as it's vice versa. And in case patients are going to have exhibit symptoms such as hypokalemia in same hypernatremia, which is extreme thirst. Coming to the renal system, here there is increased urine output in case of hyponatremia, and in case of hypernatremia, there is decreased urine output. The integumentary, that is the skin, changes. The patients are going to have dry mucous membrane in case because there is fluid loss heavily, and on the other hand, in a case of hypernatremia, patients are being hypervolemic, so the blood content is volume is high along with the viscosity is getting increased, so patients going to have dry sticky tongue, mucous membranes are getting dried, and there is evident edema. So this is a picture which is stating that how the symptoms of hypo and hypernatremia, to keep it in your mind as such. Signs and symptoms, mostly all the central nervous system you can keep in your mind, and of course the gastrointestinal symptoms here. So gastrointestinal suctioning, excessive can lead to hyponatremia, excessive diarrhea, and might be no salt intake, or might be due to increased osmotic diuretics, or even diuretics can cause, or might be excessive vomiting, which causes hyponatremia. In case of hypernatremia, you can just keep this mnemonics into your memory. That is fried salt. F stands for flushed skin, fever, which is low grade. R stands for restlessness, irritability, anxious and confused. I stands for increased BP and fluid retention. E stands for the edema, which is peripheral, and that is pretty much pitting edema. And when you take the urine output, it is very much decreased and there is a dry mouth. S stands for skin, which is flushed. A is agitated, the patient is feeling very much agitated and palpated, and low grade fever. The last one is thirst. So who are the patients who are at risk to develop hyponatremia, and who are the patients who can develop hypernatremia? NA. So yes, those persons who are not at all having, or not at all having the sodium restriction, or might be they are not, okay. So increased sodium excretion. Excretion means it is going out from the body. So might be in case of diaphoresis, excessive sweating, the patient is going to have high fever. And then in case of diuretics, usage of either loop or thiazide diuretics. Diarrhea or vomiting, as I told you, NG suction. Decreased excretion of aldosterone. Or might be in certain disorders of the kidney and heart failure. So certain disorders such as you call it a syndrome of inappropriate antidiuretic hormone, and then you have adrenal insufficiency, and in certain cases by fasting or nil per oral due to inadequate sodium intake, or might be in case of renal diseases such as renal failure and heart failure. On the other hand, you can see the common risk factors such as excessive losses, or might be repeatedly taking large amount of sodium, such as orally they are having. You would have come across like some patients, what they do is that they keep on the table the salt, even though they are adequately provided with salt, they have the habitual storage on the table and they add excess salt. So increased sodium intake, or might be frequently using pickles and puppets and other packed items, which can cause this condition, which is hypernatremia. And due to infusions of hypertonic solutions, IV, or might be due to heavy losses of fluid through diarrhea, fever, diabetes insipidus, excessive sweating and infection. Decreased sodium excretion may be due to renal problems as well. So last but not the least, coming to the management, in case of hyponatremia, we are going to start with IV infusions, start the diuretics if it is due to hypervolemia, daily weightage can be done, safety, that is orthostatic hypotension is high risk, so prevention of falls must be in place onto the patient by using the Morse fall risk assessment tool, and then you can start with IV protection in case NPO is and patient is looking very much lethargic in order to prevent respiratory arrest, and then you can limit the water intake if they are under hypervolemia and teach the food that are having salt content. If it is due to hypernatremia, then due to fluid loss. So administer the IV fluids so that you can dilute the salt content in the blood. And if it is due to inadequate urine excretion, then we have to start with diuretics and then we can control the sodium level. And certain patients are in fluid restriction as well as sodium restriction. So these are the foods which are rich in sodium. So you have to teach the patient which are the foods rich in sodium and that can be increased or decreased according to the condition. So sodium and potassium are opposite, as I told you earlier. When there is potassium level is increased, the sodium level is getting decreased. So these are the potassium chloride. In case of hyponatremia, we start with 3% NS, which is higher than the normal. So the normally what we infuse is that 0.9%. So in this we are going to use 3% of normal saline. And as the patient is high risk for developing respiratory arrest due to the respiratory failure, then we are going to have all the things by the same, especially airway, oral, and this is airway, that is we call it as the laryngeal mask is being inserted. And if you wanted to start with the excretion part, then we're going to start with low diuretics, which is furosemide. Being a nurse, start with vital signs, maintain the fluid balance, maintain daily intake and weight, as well as you're going to maintain the IO chart. You're going to closely monitor the neurological symptoms, administer the IV fluids as per the prescribed to the patient, and try to have restrictions on salt as well as fluid as per the condition. And that's all for today. To conclude, we have sodium is more than the lab report which you have the number on the body. It is actually affecting each and every cell when it is being increased or decreased. So early monitoring, early detection and a timely correction is necessary. So being a nurse, do the prompt check and start to restore the body and maintain the stability. Thank you for your patient listening. Don't forget to subscribe and forward the channel content. And in case if you have any doubts or suggestions, please put on to the comment section. Thank you for your patient listening.